I think that, first of all, we want to look at jobs and economy, and we want to do the kinds of things that will attract good business to our state, also help those businesses that are already here. And a part of that is having an educated workforce. And I see MTSU as being a part of that. With all of the great programs that are here at MTSU, we can supply this area and throughout the state with educated workforce. I do not think that we should have taken the Medicaid expansion, and I'm glad we did not. The program was set up to entice states to take on more Medicaid by saying that the federal government would pay more of the cost of it. And they're finding now that it's breaking the federal government and that they can't afford the program. And so I'm glad we didn't get ourselves into something that the funding would be withdrawn and that the state would not be able to continue to operate. I am a true believer that if the federal government got out of our way, myself as a nurse, that I could have programs where we could provide those kinds of services for people that are not necessarily insured, and the uninsurable population could be covered by a program through a block grant that we would put together ourselves without having the federal government telling us what to do. Well, health care is different than health insurance, and I think we use the word health care and combine the two. First of all, let's just talk about true health care. I think we should have simple, decent health care that is available to everyone, whether they have insurance or not. And that's something that we can do through public health departments, federally qualified, state health departments, where people can pay according to their income. And we already have models for that are working very well. There's one in Cookeville that is a great model where you can get simple, decent care at a cost you can afford. And then on the insurance side, being able to continue to work with those that are the insurance providers, such as the Blue Cross and Blue Shield and the United Healthcare, to find a way that they can have programs that can help us with people who do need insurance. I want to make sure that students are aware of their own God-given talents. And a part of helping them do that is through taking an aptitude test and to say, this is what I'm meant to be, something you may not even have thought of that is an innate talent for you, and then match that up with the ability to be able to see what jobs, what career opportunities there are there. And I think we're missing that opportunity right now. Too many students graduate from high school and don't have any idea about what they want to do. I think that the Tennessee Promise, being new, is certainly yet to be looked at and make sure that it is working as intended. We want to make sure that we're measuring those who are taking the classes, whether they're completing them, whether they're matriculating on to the next level. And so I think measuring and making sure that these programs that we put into place are measurable and that we're constantly tweaking them to be the best they can be. So I do stand by the President's decision to ban people that were coming from those countries where we knew that they had active, hostile activity toward the United States. And there's nothing any more important to any of us than safety. You know, if we look at the hierarchy of needs, we find that at the very top of that is safety. And if you're not safe, you can't eat, you can't sleep, you can't work, you don't do very well. And that is our number one role as a government, the federal government, is to protect the people of this country. And so I think it's rightful that when people are coming from countries that we know are hostile to us, that we make sure that those that are coming to our country are safe and that they don't want to harm us when we come here. And I do believe that that's the right decision to make. I love the state of Tennessee. And although I'm not a native of the state of Tennessee, I've lived here now for 31 years, and this is my home. And I am excited. I'm really excited about having the opportunity to be able to make the state even better. We have a great state, low taxes, we're doing very well in the economy, we're about in the middle of pack of education, but there's no reason why we can't do better. And I'm excited to be that person at the executive level where I can lead our state to be the top in everything, in economic development, in jobs, in education, in our health care. And I think I'm uniquely qualified to do that.